Hey, everybody, and welcome to another edition of the Migraine Mentors Minicast. I am one of your hosts, Dr. Erik Reis, one of the Migraine Mentors, and I'm really excited to talk about today's topic because I feel like I get this question all the time from patients. They're always asking the question like, listen, I struggle with migraine. What's the situation with caffeine? Can I have it? Can I not have it? Should I stay away from it? Should I drink more of it? And so this week's deep dive is really something that I learned a lot about, but more importantly, too, I feel like it's going to help so many of you because this question is just something that so many people have asked us. And so, really, depending on who you ask, caffeine's kind of either like the devil or like a girl's best friend kind of situation, right? So, what's the deal? We really don't have full transparency on this. And so, what we did is we did a really big deep dive into this because caffeine, believe it or not, has the ability to both either soothe your migraine symptoms or stir up activity. And it all depends on a couple different factors that we're going to get into. So it really does come down to the dose, the timing, and your baseline habits. Those are the TLDR for you if you don't want to listen to any more of this episode. But first, we should ask the question like, why caffeine? Well, caffeine is really an adenosine receptor antagonist. What does that actually mean? Well, it means it blocks receptor sites. It's almost like you sticking a key into a lock and that key breaks off. That broken key still occupies that lock, that receptor, but it's not really doing anything. So caffeine kind of has this little trick that it plays on us where it makes us think that we actually are getting more energy when we're really not. Over time, as these adenosine receptors get saturated with adenosine, the breakdown of ATP, the cell's energy currency, what happens is our body and brain start to feel a little bit tired and fatigued, and that's kind of our signal to go to sleep and restore all of that and recycle it. Caffeine blocks those receptors, so it gives us this urge or this sense of having more energy, but it's actually a bit of a party trick. What we know is that caffeine can actually boost the effects of common OTC pain relievers, especially during an attack, which essentially kind of gives it a little bit of like a secret weapon for pain management. But as great as that sounds, we know that abrupt changes in caffeine intake, so either too much or too little, can actually trigger migraine attacks. So really what we're talking about here is too much of a good thing can actually be a bad thing. So how do you decide what actually works best for you? Well, here's what the data shows about when caffeine can actually help migraine patients. So fixed dose migraine medication combinations that include caffeine in randomized controlled trials actually show evidence for acute migraine relief. These are the people who swear by like the popular TikTok posts of like having like a soda and fries for their migraine management. Now, first and foremost, I will never condone that because there are so many negatives that come from that combination of food in general. But there is a little bit of truth from the fact that if you're somebody who consistently needs caffeine and you have caffeine during a migraine attack or before it, you can actually kind of negate some of those issues with the migraine attack being completely exploded. In 3 randomized controlled trials, about 1,220 patients, acetaminophen, which is Tylenol, plus aspirin, plus caffeine actually outperformed placebo for pain management and migraine symptoms, which is actually quite impressive. In head-to-head trials, patients with severe migraine actually found this combination was as fast, if not faster, than just taking ibuprofen alone, which once again shows that the combination of the over-the-counter pain management medication and caffeine is actually a really interesting combination for a lot of people. There's also a really interesting crossover study that was performed in 2012, which showed that 1,000 milligrams of Tylenol, aka paracetamol, for those of you who are in Europe or throughout the UK, plus 130 milligrams of caffeine, which is about 2 cups of coffee, provided similar benefits to 50 milligrams of sumatriptan. So, the patients who were taking triptans or sumatriptan or rizatriptan actually saw the same benefits as taking 1,000 milligrams of Tylenol and 130 milligrams of caffeine combined together. Super interesting. Lastly, if you take a look at what the American Headache Society posts and what they kind of follow for guidelines, yes, we will fully admit that migraine is not a bad headache, right? We've talked about this ad nauseum. But if you take a look at what the American Headache Society talks about, they actually list caffeine-containing combination analgesics as evidence-based options for acute migraine attacks, which should show you that there's enough evidence there to talk about using caffeine in combination with over-the-counter pain medications to manage migraine attacks, whether you're in the prodromal phase or you're actually in an acute migraine attack. But there's also a caveat, right? Because as you can see, there's clearly enough evidence here to show that the use of caffeine before or during an attack is efficacious. But with everything in life, there's always exceptions to the rule. So let's get into how and when caffeine can actually trigger migraine attacks. In 2019, they did a really interesting prospective cohort study with a bunch of adults who had episodic migraine. And what they found is that consuming more than 3 caffeinated beverages a day vastly increased same day migraine odds. Well, if you stuck in that window between like 0, 1, and 2, depending on your previous threshold, you actually did relatively well, and you didn't raise any of your risks for having migraine attacks. Another prospective cohort study in 2024 was found that people who habitually took caffeine, this was actually not linked to attack frequency, duration, or intensity, which essentially means that any deviations from your personal caffeine baseline is where you're actually finding yourself getting stuck into these attacks or these triggers for migraine. So if you're somebody who consistently has like 1 cup of caffeine or coffee a day, well, if you deviate from that norm and you struggle with migraine, your deviation from that norm might actually be a trigger for your migraine attacks. If you're somebody who never consumes caffeine and you rarely consume caffeine on a normal basis and you have a migraine attack, and all of a sudden you consume caffeine, that actually might be a trigger for you or further amplify your symptoms. So I want to point out, because I think this is a small caveat, but I think it's relevant, there are differences between caffeine withdrawal headaches and migraine, okay? So a caffeine withdrawal headache is a completely different diagnosis than an actual migraine. So these are completely different diagnoses, they're completely different treatments, and as you can assume, this is not a classic migraine. Interestingly, in 2020, there was a really interesting randomized double-blind controlled trial which showed that people with migraine showed abrupt caffeine cessation actually triggered severe migraine attacks in most participants, whereas continuing caffeine did not. So once again, TLDR, right? If you live with migraine, sudden changes, so like big spikes, little spikes, can actually provoke a migraine. And it's not just a generic like withdrawal headache. This can be a full-blown migraine attack. So for those of you out there who are migraine, we're sure that a withdrawal headache would just be a walk in the park for you. We realize that if you're having a withdrawal headache from not consuming too much caffeine, then that's probably going to be something different than your normal migraine attack. So you can, and you're allowed to, have more than one thing going on. But if I were you, I would just kind of stick with what the data shows. And more importantly, too, with all of this being said, the best thing for you to do is to try things on your own and see what works for your brain, your body, your nervous system. As we've talked about in the past as well, everything's about personalization. But here's a really quick synopsis about how to drink coffee and really to not be in pain. So for those acute migraine attacks, you should consider the previously listed evidence-based combinations that are acetaminophen, aka Tylenol, aspirin, and caffeine, rather than just consuming caffeine alone. The combination of caffeine and those over-the-counter pain medications is where the sweet spot really sits for these acute migraine attacks. It's really important for you to also keep your caffeine intake consistent, okay? Those large spikes in caffeine, or if you're consuming greater than 3 cups of coffee or having doses of caffeine per day, will inherently increase the odds of you having a migraine attack. And so this steady intake has just kind of been deemed safe for relatively everybody until you get up to that threshold of more than 3 cups of coffee a day. If you want to reduce your caffeine intake, which I'm never against, I'm necessarily never for either, it's better for you to taper your dose over long periods of time to avoid that withdrawal headache and or a migraine that's triggered by the abrupt caffeine withdrawal. And then lastly, it's really important for you to avoid late day caffeine consumption. Like they say no later than 12 p.m. And the reason why is that caffeine has a 6-hour half-life, which means if you have 100 milligrams of caffeine at noon, by 6 p.m., you still have about 50 milligrams of that caffeine rolling in your bloodstream and in your brain. And by midnight, it means you have 25 milligrams of caffeine still rolling through your nervous system. So if you struggle with sleeping, then you kind of got to start with your habits early in the day. And caffeine consumption later in the day is one of those big things that we know a lot about. It's really well documented. It's just a habit that you got to get over. So I just made myself a chamomile tea. I love caffeine. I can't have too much of it, but I can have a little bit. And so a matcha tea and a green tea in the morning is something that just gives me my sweet spot, gives me my happiness, my joy. But after that, I get too jittery, get too frigid. I kind of just get too cold. I get an autonomic response. So remember, if that's you, and if this is something that you're trying to work through, take it slow, take it easy. Know that there's rules and guidelines, but just like music, like you learn the rules first, and then you kind of learn how to break the rules over time. So if this is something that you're struggling with or you want more information on, I hope that this was able to empower you and educate you on what you can do with caffeine. Caffeine is literally the most widely used drug in the world. And for most people who drink it, like this seems to make the world a bit of a better place. If you're somebody who struggles with migraine, you know that there's caveats with every single thing that we've just mentioned. But I hope that you're able to take away a ton of information from this, and this gave you a little bit more clarity as to caffeine and migraine and how to combine the two together. So if you're somebody who is a subscriber to the Migraine Mentors newsletter, thank you for being a part of our community. Thank you for your feedback, and thank you for your unenduring support. As you know, we publish this newsletter every Wednesday morning at 6 a.m. Central Time. If you're somebody who's struggled and you found this video, we've taken 20 years of clinical practice and bundled it together into this platform to give it to you for free to see if there's ways to help you from an integrative, holistic way to treating your migraine symptoms. So once again, my name is Dr. Erik Reis. I'm one of your migraine mentors, and I hope to see you at the next episode.